Well, Carrie, thanks for being here today.
Yeah,
First of all, can I ask your title, and then we can get into EpiEarth.
sure. Yeah, so my name is Carrie Manore. I am the group leader of the Earth Environmental Systems Observations and Modeling for Earth Systems group, which is a mouthful. And I led the project EpiEarth.
So EpiEarth, in simple terms, can you say what problem is EpiEarth trying to solve? What is the core focus of EpiEarth?
Right. So EpiEarth is a tool that we created that allows us to model infectious diseases at a continental scale. And in particular, the EpiEarth part indicates that we're modeling infectious diseases that depend on environmental drivers. For example, mosquito-borne diseases, tick-borne diseases, wind-borne diseases, those kind of things.
So as inputs, you take a whole bunch of different variables into account?
Weather, land use, human population, agriculture, all sorts of things that impact those kind of environmentally driven diseases.
Just briefly, what kind of data is in EpiEarth? Like, is a whole bunch of different variables there? Is it all in one kind of database, or like?
So the data we set up to be modular, and that way, this is a unique thing about this tool too. So we're not stuck with one pathogen, one disease, one thing. So we created it so you can slide things in and out. So there's a weather Earth system module, and that has things like temperature, humidity, precipitation, land use, vegetation. Then we have a model that's like mosquitoes, for example, where we'd have mosquito data or tick data. Then we have a human model where we know where the human populations are and where they might be coming into contact. So that has a bunch of human population data, land use data, things about poverty, things that have impacts on the probability of spread. So wide range of data goes into it.
Can you talk about what existed before? Like, what is the backdrop? Like, what was the status quo that led to the development of EpiEarth?
Great. So most models before this focused on one location, one pathogen, right? So it'd be like,
Very narrow.
I'm modeling West Nile virus in Chicago. And we saw this need to say, what's happening at a continental, at a regional scale, not just in this one city here and there that has a separate model. So is there a unified model that can give us that kind of continental scale prediction of risk for those pathogens?
Can you briefly talk about the predictions? I'm sure it's more than linear regression. You have so much data.
Oh, yeah.
Right.
Yes. So that's another thing that's modular, but what we wanted to do was make sure that we could include what we call process-based models, which are models that incorporate the underlying dynamics so that we can run what-if scenarios. If it's purely statistical, it's hard to run, what if I spray all the mosquitoes? What if we come up with some amazing vaccine? What happens then? It's hard to run those scenarios. So we have an underlying model that can adapt to different scenarios as we try to plan for decision making.
It's not a question, but that sounds cool. I mean, it's infectious disease, so it's serious, but that sounds thoughtful.
It's super interesting.
Right.
Yeah, it's very interesting.
And then, so evidence so far, so you have it out. So can you talk about like real world, kind of like what benefits have come from it since it's been developed, like traction, things like that?
Yeah, sure. So one of the things that it does well, and one of the examples is predicting mosquito populations through time and space, which is surprisingly challenging to do. Like being able to tell when they're going to emerge. Is it going to be a really big mosquito year or not so bad mosquito year? So this model is really good at capturing that and predicting that. And we've done case studies in Toronto with West Nile virus that have predicted really accurately what's going to happen. We're working with the San Diego Department of Health for their mosquitoes and dengue. And then we've also worked on predicting and validating in Brazil for dengue virus. And it does really well in all those scenarios.
Imagine there's like a global map you can like see at a glance. You can zoom in, you can analyze the data in kind of 3D space.
Yeah, that's right. So I will say that like, while we created it to be modular, there's effort in getting every new disease in and validating it, right? But yes, it's set up so that we can see the whole map, but we can zoom into regions to as low as a 1 kilometer scale.
What were some of the biggest challenges when creating EpiEarth?
Yeah, there were a lot of challenges with doing this. One is all the data, which you mentioned before, and getting it aligned. Yes, normalizing it, getting it aligned. Mosquito data is all over the place. You have to like get individual mosquito control boards to send you their data a lot of times. Whether all these things are at different time scales and spatial scales. So big challenge is getting the data and getting it aligned in a way that you can actually model it. The second piece is that, oddly enough, a lot of these environmental drivers change depending on what kind of ecozone you're in. So for example, it might look really different in the desert, how mosquito-borne pathogens respond to temperature as opposed to, you know, a rainforest or the mountains or whatever. So each different kind of ecozone has different drivers, and that's also challenging. There's no one size fits all.
Can you speak, last question, can you speak to the plans beyond here? You mentioned you already have traction, like what do you see kind of coming down the pike?
So we're continuing to work on the mosquito-borne stuff. People are really interested in tick-borne, like Lyme disease. That's a big problem, and we know that the ranges are changing and expanding for these. We're also working with folks on the agriculture side. So a lot of the same drivers for pathogens that infect plants that are crops, and also things like cows, chickens, pigs, all those kinds of things. So there's also traction on that end too, and particularly from a biosecurity perspective.
Well, thanks for your time. Congrats on the win.
Thank you.